Okay, good afternoon, and thank you for joining us for today's Rensselaer Global Game Changers panel online discussion presented by the Rensselaer Silicon Valley Executive Council. The impact of COVID-19 on current and future consumer expectations. This afternoon, we have over 300 of you registered for this exciting panel discussion as part of the newly established Rensselaer Global Game Changers panel online series. These webinars are high-profile thought leadership panel discussions presented by regional executive councils in key geographic regions, including New England, New York City, and Silicon Valley. Each panel features a topic of emerging global importance with alumni and alumnae leaders in business, innovation, intellectual discovery, and entrepreneurship. A few housekeeping items before we begin. Please make sure your volume is turned all the way up. You will be throughout the presentation out of respect to our presenters. You will see that there is a Q&A feature at the bottom of your screen. Please feel free to type in your questions. We have also collected questions during the registration process and we'll get to them as time allows during the Q&A portion of the program. I'm now pleased to introduce our host and one of the panelists for today's discussion, Dr. John K Peck of the classes of 1983, 1984, 1985, 1987, and 1988. Is chair of the Rensselaer Silicon Valley Executive Council and executive vice president for ventures at Abbott, where he leads venture investment. Dr. K Peck previously served as executive vice president for medical devices and senior vice president for Abbott Vascular, where he added Abbott's global vascular business, Abbott's global vascular business. Dr. K Peck has a bachelor degree in biomedical engineering, a master's degree in biomedical engineering, a master's degree in electrical engineering, a PhD in engineering, and a master's degree in business administration, all from Rensselaer Polytechnic Institute. Please welcome Dr. K Peck to the program.
Hi, well, thank you very much for the introduction. I am delighted to participate and to thank everyone in attendance for joining us today. I'm also pleased to announce that Dr. Shirley Ann Jackson, president of Rensselaer Polytechnic Institute, is joining us on this webinar today as an attendee, along with three of our trustees of the Institute, Curtis Preem, class of 1982, and secretary of the board, as well as Catherine Murtaugh, class of 1987, and Jeffrey Kodosky, class of 1970. You know, as a Rensselaer alum, it makes me proud to see my alma mater step up in contributing AI computing power, faculty research, scientific capabilities, and other activities to help fight the COVID-19 pandemic. You know, Rensselaer's always been a leader, and the education and training that Rensselaer students receive enable them to solve problems through science and engineering. If you haven't done so already, I encourage you to join me in supporting the Rensselaer Annual Fund or to give to the groundbreaking research at Rensselaer that is helping lead us out of this challenging situation. There'll be more details provided at the end of this discussion. As mentioned, the Rensselaer Global Game Changers panel online webinars are the virtual versions of traditional in-person panel discussions that are presented by executive councils in key regions where we have engaged alumni, alumnae, and parents who are innovators, senior executives, and venture capitalists. These regional networks have been created to strengthen these connections and offer opportunities for engagement with the Institute. Today's conversation is presented by the Rensselaer Silicon Valley Executive Council, where nearly 4,000 alumni, alumnae, and parents call home. I would like now to introduce the moderator for today's discussion, Dr. Peter Izella, who's co-chair for the Rensselaer Silicon Valley Executive Council and provost at Rensselaer Polytechnic Institute. Dr. Izella is responsible for all academic portfolios at the Institute, and in collaboration with the Vice President for Research, works to strengthen the research missions of the Institute. He previously served as Vice Provost and Dean of Undergraduate Education, where his broad administrative mandate included oversight of all undergraduate programs, including engaging the 5 academic schools in program development and implementation. He's also served as the Administrative Dean of the School of Humanities, Arts, and Social Sciences. Welcome, Dr. Izella.
And let me invite you to stay on as a member of the panel. It is my pleasure now to introduce Ms. Archie Deskus of the class of 1990, who received her Master of Business Administration from Rensselaer. Ms. Deskus is a Senior Vice President and Chief Information Officer for Intel Corporation, where information technology is capitalized to accelerate the company's significant growth goals across a very diverse portfolio of businesses. Ms. Deskus previously served as Senior Vice President and Chief Information Officer at Hewlett Packard Enterprise, where she was responsible for infrastructure and technology resources, working closely with the HPE's businesses to achieve the company's strategic goals. So welcome, Ms. Deskus.
Thank you. Pleasure to be here.
Our next panelist, Dr. Peter Fitzgerald of the class of 1981, is the director of the Center for Cardiovascular Technology at Stanford University Medical School, professor emeritus at Stanford, and managing partner and co-founder of Tri Ventures. Dr. Fitzgerald's laboratory includes 17 postdoctoral fellows and graduate engineering students focusing on state-of-the-art technologies in cardiovascular medicine. He has led or participated in over 175 clinical trials, published over 550 manuscripts or chapters and lectures worldwide, and trained over 150 postdoctoral scholars in engineering and medicine in the past decade. He heads the Stanford Asia MedTech Innovation Program and has been the principal or founder of 21 medical device companies in the San Francisco Bay Area. He has transitioned 14 of these startups to large medical device companies. Welcome, Peter. So, as you can see, the assembled panelists represent a remarkable group of individuals who bring expertise from businesses that are bringing life-changing health technologies to the people who need them, to hardware and device companies that have driven the IT revolution, to an academic entrepreneur who has been a tour de force in taking new research advancements in biotechnologies to the marketplace. As for today's topic, we have seen how COVID-19 pandemic has shuttered economies around the world. It has had an impact in every arena and each of the business sectors represented on this panel. The consumer mindset, which is so important for businesses to understand, has perhaps undergone a tectonic shift of its own during this pandemic. As restrictions lift and pockets of spending return, consumer preferences and behavior will begin to adapt to the next normal. What this new normal will be remains to be seen. And today we will get to hear from our panelists what they think about the impact of COVID-19 pandemic on consumer expectations, both current and future. So as we begin to get started, let's just put aside COVID-19 briefly. And my first thought is for us to begin probing exactly what dominates the wellspring of human action. We all know that expectations drive those actions. On the one hand, the majority consensus is that our choices can and should be made according to some rational model, determined by reason, knowledge, science, you name it. Yet as I look around, I see vivid evidence of forces of irrationality as a driver in decision making, like the run on toilet paper, for example. My first question then is the following, and I'll ask each one of you this question in turn. You each represent a distinct industry sector, and you each have a unique perspective on consumer expectations. What are one or two most important drivers of consumer expectations? I recognize that your businesses are very diverse, so you could restrict your response to that aspect of the business with which you have the greatest familiarity. John, let me begin with you.
Well, thank you. You know, I'd have to say, although we do represent those different industries, you know, I'll say this, it'll sound somewhat prolific, but consumers consume. And they consume in the consumer market and they consume in the med tech or financial technologies market. And I think what's been added to what consumers have not only historically expected, but will expect going forward is, they came to appreciate online, on demand, on time, and on spec. But I think an added degree has come into play, and it's predominantly driven by COVID, is the expectation of safety. Peter Fitzgerald has used the Uberization of healthcare, and now I think that's taken a new meaning, because I want things online, on demand, I want them in spec, I want ease of use and engagement, and I want them to be safe. And I think this added factor is how many people are going to modify their consumer behaviors going forward, even beyond what they expected before.
All right, thank you. Peter, do you have something to add to that, or your own thoughts on that issue?
Yeah, I think this on-demand, or at least from my vantage point, distributed care has been evolving for the last 4 or 5 years with the digitization craze that has moved into healthcare, but it has definitely been accelerated. And I think the impatience component of having things quickly, easily, and efficiently with safety, which is a very, as we postulate we're going to have vaccines, for example, those vaccines need to be safe. We can't accelerate those because we think we need them because of that fear issue. So I think for us to make sure when we deliver things to consumers that we do, as a community of folks that deliver healthcare entities, we do make sure that safety box is absolutely checked, because we can get caught up in policy and politics here and maybe not necessarily focus completely, as we have over the years through the FDA and the CDC, on that safety profile. And that's important as we get into vaccines and those discussions about the present environment.
Archie, do you have something to add to that?
Yeah, look, I think from a technology industry perspective, as we think about, consumer, it's really with the industries and the businesses that we support. And we really see data as the disruptive force here within the tech industry. And look, we're in an era where we rely very heavily, right, on smart connected devices for all of our interactions, whether it's healthcare, education, every industry, right, has been shifting in this direction. And so if we think about our homes, our cars, our cities, our hospitals, they all look like computers, right? And it's staggering the amount of data that they all generate. And so if we look at retail stores, hospitals, manufacturing plants, cars, right, they're all factories at this point of data. And all that data that gets generated, from a tech perspective, obviously we have to provide, the processors, the computing power, the connections. On average, the world creates about 2.5 quintillion bytes of data a day, right? We send 16 million text messages, 600,000 photos via Snapchat, 95 million photos, are shared daily on Instagram. And so there's just tons and tons of data. And so as our customers continue to explore how to use that data in new and different ways to transform, what they provide to consumers, we really are focused and think about a data-centric world, and how do we, focus on not just moving, storing, and processing that data securely, but we also, think about, how do we bring a different type of innovative mindset, right, to give higher value propositions to all of these industries. And so for us, we're focusing more on smart chips and processors, that are at the core of these intelligent devices. And how do we take all that data and help provide valuable insights that drive a different value proposition for the consumer?
Thank you. Let me stay with you for a moment, and with this next question, which is that, and again, I'd just like you for a moment not to think about COVID-19, but cast your mind back at all of the other engagements that you've had with your company and your industry sector. Consumer expectations have been described almost like shifting sands. So are there examples of other local or global events that may have changed consumer expectations in your sector? And then how did your industry react to adapt to those changes?
Yeah, I think for, again, I think for the tech sector, right, it is more about expectations from a consumer, that everything that they do in a physical world, right, that you can do in a digital world, and that experience is going to be more connected, more personalized. And so if you think about, the tech industry, like I said, data is a huge focus, right? How do we, drive, that connectivity? We have so much data, but how do we get, the value out of that data? So that's one. Obviously there are technologies that, are critical to, how you make those connections in the data generation. And that's about, IoT. It's about, 5G. It's, AI and how you leverage AI, right, to modeling, to get those, the intelligence and the automation, if you will. So for us, I mean, it's really about the underpinning, right, to make all of that happen. And whether pre-COVID, post-COVID, I mean, I think that journey is that's definitely going to continue, accelerate. And I think the expectations aren't letting off. I think if anything, with COVID-19, you're seeing a greater dependency on technology, right, both in personal use, at home. And more and more of the remote work from home. So I think the industry is continuing forward on a lot of these technologies and advancement to be able to support how consumer expectations are and behaviors. Pre-COVID-19, the state that we're in, and obviously I think the state that we're in right now for a lot of these industries is causing faster disruption, right? When you think about education, almost overnight, we've got students at home, and how do you get to that learning experience in a digital world? And I think we've all had it, but not as the primary, right? It's been augmented, whether it's work, whether it's learning. If you think about all these experiences, we've had the technology, but it's been augment with the technology at home versus in place of. And I think that's where with COVID-19, we're seeing an acceleration on, how do we get there sooner and faster with more capability.
Mm-hmm.
Prabhat, one of the things that, Archie has been, bringing to all the expectations of consumers is fast now, and as John says, online. The data are extremely important. We always in healthcare lag behind a little bit.
Mm-hmm.
But for example, being able to use some of those data, hierarchically make a 30-year-old treating somebody with hypertension as good as a 60-year-old that has machine learned in his or her head already. That's a very important issue from a safety and an effective standpoint. In fact, at the FDA, we don't call it AI. That scares everybody. They think it's artificial. They think it's autonomous. We call it IA. And that intelligent augmentation of the healthcare provider not only allows it to be accelerated, those attributes be accelerated for FDA approval or certification, but it doesn't take the healthcare provider out of the loop. That healthcare provider sits at the 4 o'clock and gets intelligently augmented by this data-driven technology, by this data-driven services that we have, and makes us deliver care better, hopefully, as John says, safer.
Mm-hmm.
But IA is the key, at least in healthcare.
And Peter, in your experience, have you come across an event that has shifted consumer expectations like the way you expect COVID-19 to do?
I struggle with trying to find
Mm-hmm.
anything that has leveled the playing field as much as this. What
Mm-hmm.
I get excited about is leveling the playing field, thinking out of the box, thinking beyond the borders. Everything goes now. A
Mm-hmm.
board member on Exxon or a board member on a little 5-person startup has never seen this before. I think that allows green grass to grow much more effectively and efficiently. So I haven't personally seen something. I've seen changes that are adopted by our millennials that are helping our matriarchs in healthcare, but I've never seen this sort of complete sort of defibrillation, if you will,
Mm-hmm.
of the landscape.
Mm-hmm. John, do you have something to add?
Yeah, I would add, well, I do agree, changing in consumer expectations are shifting sands, but I'd have to say this has been a tsunami, and a global tsunami at that. And, we can remember, in 9/11 in 2001, it was clearly something which shook us as a country and shook the world. And it caused and changes in consumer expectations. And I think what I think I reflect upon here is the means by which we changed our behavior was fear. And to overcome fear, we, as a natural human being, we like to take control of things we can control. You mentioned that I was fearful of the virus, so I controlled my toilet paper supply. I'm not sure why that was important, but that's what I could control, and that's what people chose to control. And when we came out of 9/11, we accepted TSA screening, but if as a consistent and frequent traveler, I wouldn't have thought 2 years before 9/11 that TSA screening would become as accepted as it is today. And it removed the fear of flying with that behavior. So, you know, we need to think about, as consumers are modifying their behavior, fear was how we came to shelter in place, and fear of the virus. And as we come out, people will look to ways in which they can control their environment and manage that fear. And many things are going to change because they were brought on by the economic and practical necessity that they have to change. I think Peter mentioned this with the demographic differences or age differences. You know, we find, or I find, my parents Zooming or ordering on Amazon, whereas that was possible before, but now it's happening at all deciles of people across age groups. I think we're going to find that things are accelerated much greater in some of the fringe population. There's nothing for my children who are used to gaming online, for them to bank online, for them to either bet online or now trade, you know, barstool trading online. It's a natural progression for them. But I do think for those in the boomers and those past the boomer age, there are things which are being tried for the first time, which will become common.
Thank you. I think you've already alluded to this somewhat, but there is clearly a difference this time around. You said it's a tsunami. Peter said that it has flattened the playing field a little bit more. So clearly, I think each one of you feels that it is different from what we have experienced in the past. And you've laid out a few ideas about the demands from consumers and customers during this period. Safety is one. Adapting readily to technology, which had existed but they had not embraced before, is another. Do you expect that these kinds of shifts have forced you to reevaluate the way you conduct business? In other words, I mean, will you alter your supply chains? Will you try to make things available more locally as people are more scared to travel and venture out? Talk to me a little bit about that.
Well, I would say it clearly has caused us to look at our supply chain in a lot more detail. And, you know, while we might have hedged against a disruption in the airline industry and managed a way to book tankers or book boats, that has been equally impacted. So the kind of broad nature by which this has impacted the world. I also think it's one where what we're observing is a ripple effect, and it has been impacting the world, but it's been impacting the world in stages. And our ability to learn as a company or as a country or as a society, how have other countries dealt with these impacts over the course of time, so that while we unfortunately get the virus to have an impact, we are fortunate of having seen other countries manage through and whatever positive learning. So I actually think as we've been adjusting for now 9 months, our supply chain in and out of China will still be adjusting as China gets on the other side of the virus and certain parts of the country are still managing through. And I think that's that global contingency planning. That's something that we've looked at. I would also say what we've come to appreciate, and I myself have come to appreciate, the companies that can manage through in this type of an environment are tremendous at scaling up, scaling down, or fundamentally changing the flexibility of their capital structures or their capital in general. And I think we're going to learn through all of this that, well, having that flexibility will allow us to be better prepared for whatever may come. and that we fundamentally invest in flexible structures, whether that's working from home, working at the office, how our supply chains are flexible to allow for them to adapt quickly in a responsive fashion.
Very good.
I think
Archie, would you have anything?
Things we noted, just on, not just on the manufacturing, the supply chain, the development of some of these efforts, but we as a hospital or a medical center really rely on some of the referral bases, and we take those for granted. That's our business. But we learned that they are as fragile as ice in the desert, and they have crumbled. And those have to be reconstituted in a major way and are probably going to be regrown in very, very different ways.
Mm-hmm.
So I don't have the solution to that, but I can tell you, every CEO in hospitals across the country are scratching their head and go, geez, we didn't think that system was so fragile. And that's going to be a really important remake of how patients get directed at the right time, the right place, for the right device. And that's what I get excited about, because I think we're going to redo that and not just rely on what we took for granted.
That's a good point. Archie, do you have something to add to this?
Yeah, I think for us, it's three things, right? I think one is helping our customers accelerate, right? And lots of use cases, right? We won't have time to maybe go into too much detail here, but just throw out a couple of examples. We're helping Medtronic, right? Obviously, everybody's heard about the ventilator supply issues, and we've been helping with the technology to address some of their environments that will help get ventilators out faster. Also with breakthrough technology that allows clinicians to adjust ventilator settings and manage that remotely. So I think a lot of use cases people talked about. I think in crisis, we're seeing in I'd say in healthcare, and especially healthcare and education, we're seeing an acceleration for, hey, we need help now, and let's kind of accelerate the digital journey, if you will. So I think for us, I think COVID-19 and shift in expectations is, bring greater partnership in application of the technology and the solutions. I think the second is the way that we work. I think the jury is still out, but I think what we've learned, and I think what the world has learned, is that we are quite functional, operating in a remote environment without everybody having to, show up in an office. And so that is certainly, opening our minds a bit more around, what is that new normal going to look like? And it's probably a balance. It's probably not all work from home, but how does that change, and what does that mean in terms of investments and facilities and expansion, of our footprint? And do we think about some of the things around growth differently than we have in the past? So I think the way we work, I think, is going to be another area for us to go focus. And then, I think some of the other comments that were made, I won't just say manufacturing, supply chain end to end, where were the weak points, where, have we learned maybe that we need to, think about our model differently, or about our agility with our model differently. For Intel, we're highly automated in our factories. So we've been able to, continue our operations pretty much at almost full volume so far through most of this, without disruption. But it was because of the investments that we had made in those remote capabilities. But it's certainly forcing us to, think about, okay, if we're in this for a protracted period, of say a year, what are the other things that we would need to have in place?
Thank you. My next question really has to do with the role of technology in meeting or managing consumer expectations. And I'm keeping an eye on questions that are coming in from our viewers as well. My question to you would have been that, has any new technology been implemented in the short term in response to pandemic-driven changes in consumer expectations? Stated differently, do you see opportunities to proactively modify consumer expectations in today's environment, the COVID-19 environment?
You want me to start on this one?
Go for it.
Yeah, look, again, I think if you think about it, I'll come back to the consumer in a minute, but if you think about a lot of these businesses and industries that are serving consumers, right? Scalability, right? Immediately with COVID-19 was, how do we keep people working at home? How do we scale up capabilities, right? From many different businesses and industries perspective. And so cloud would be one. I think companies that, had greater adoption rates or, had been further on their journey, even with the hybrid strategy, they were able to scale up really fast, right? So whether you're looking at, capabilities around video conferencing, some of even, the shopping sites, et cetera, how quickly were those businesses able to scale? And a lot of them, like I said, cloud was a core, piece of that strategy and ability to scale. So I'd say during COVID-19, that was probably one of the biggest ones, early on. I think the second is, and we're even rethinking this, right? We saw a big spike in, laptops, right? If you think about a lot of these businesses and how, they're supporting their customers, they didn't have the capabilities for their workers to work from home, right? From a device perspective. And we're seeing almost a 15% uptick, right? In usage of people with laptops. Mobile, it was thought that mobile was the answer, right? And that everything was pivoting towards that, but we're seeing a growth, quite frankly, in laptops. And so the solutions that we have, right, for, how we connect people, and the types of solutions that we need, I'll take conferencing like we are today. The conferencing and collaboration platforms that we have, they're good, but they're good as augmentation. They're not great for, hey, if this is, my new reality, okay, this is probably not sufficient, right? I probably need a camera, that allows me to whiteboard, a camera that allows me to do video, so forth and so on. And so I think, with COVID-19, those that are able to, I think about those types of needs, right? And keep, their businesses operational, right, and effective, I think are coming out, stronger. And so I think with COVID-19, it's been, like I said, maybe a little bit of acceleration in some cases. In some cases, I think it's kind of thinking even more broadly, right, of these technologies are there, but how do we make them even, better and more functional?
Mm-hmm. Peter, how about AR and VR in the space that you work in?
Yeah. Before we get into that, just to sort of take Archie's comments into healthcare, if you don't mind, one of the things we see that's very exciting is a convergence. I'm very proud to be with a venture fund that has its LPs, not only the life science folks, not only the IT people, but we're seeing entertainment and insurance folks come in now because they can give from actuarial all the way to stimulus to get people off the couch to think about their wellness and fitness and prevention. So today, it's a green field. And so you begin to see these other disciplines come in. So that convergence that Archie's talking about just got pushed, just got accelerated by this process. We have technologies that go inside a bed. So the minute you lay on the bed, you've got your heart rate, you've got your temperature, you've got your movement, you've got your respiratory rate, you've got your imputed oxygen. So you can take care of people at home through telehealth, through having, either the family or a nurse there. We wouldn't do that before.
Right.
There's another effort that if you want new eyeglasses, you just simply look at your cell phone, push a button, and your prescription glasses will be there in 12 hours. You don't have to go to some of the places that are closed. But once you get used to that, you may not go back. So I think some of those issues are very important. We see VR as an ability to help transition how you teach a doctor to implement new tools. For example, we sales folks can't really go into the hospitals now, and we're going to find that we're going to Zoom more. But just like Archie said, you're going to have a camera to see what I'm seeing, so I can be proctored accordingly remotely by somebody that's seen this 1,000 times. And we're going to and some of that VR technology is going to allow that. And plus, we're going to have to do in-servicing of new technology through some of that VR, AR. So I do see the accelerant of those three areas: convergent, some of the on bed, if you will, or on board adoption, as well as some AR and VR in the hospitals communicating remotely with in-servicing or onboarding.
John, I'd like you to take a slightly different view of this, that where we have been successful mostly in switching to a remote environment to use the kinds of technologies that Peter and Archie have just described, we sort of knew who we were working with consumers and customers. So the transition may have been eased somewhat by the fact that we had worked with them in person. Do you suspect that there is going to be a little bit more difficulty if we stay with these kinds of tools and then bring in a whole new set of consumers and customers who we have never interacted with in the past?
Yeah, I think it's difficult and been difficult to put what we might call consumer panels together and get customer feedback. And particularly in our med device area, you can only go so far with your engineers before you need to put the product in the hands of a clinician. And whether that's in vitro or in vivo, or as Peter was describing, really to get their feedback in a patient, that's been one of the most difficult things to manage through in this environment. But I do think, and Peter mentioned in the context of remote proctoring, I think we're going to need to create structures where we can, whether it's not necessarily it's augmented reality, not necessarily virtual reality. I want to have a clinical condition patient, and I want to insert my product into the hands of a physician and essentially get that feedback. And the same would be true for us as we do consumer preference testing for Similac, or what we might do in next generation, nutritional product. I think we're going to find that technology becomes the solution. And you asked this question earlier. I don't think that we see a new technology emerging, but as Peter mentioned, we're seeing technologies migrate from one application to an application that wasn't thought of before, because it's now either an economic or physical necessity for it to be that way. Telemedicine was interesting and a trend, but when you can't go to see your doctor, it becomes a necessity. And I think that catapults technology to be used in ways that consumers might not have wanted it that way or appreciated the benefits of that way, but it's going to hard to disconnect them from the benefits on a go-forward basis, because they feel them, they see them. Why go to the doctor when you're sick and be there with other sick people? I'd rather be sick at home and get the care I need at the doorstep.
And I think what Archie said about using a laptop, now that may change, but trying to use a cell phone and do patient-doctor speaking and have the ability to look at chest x-rays simultaneously, or look at while they're, touching their computer, have their electrocardiogram go. I think that's going to bring back a surgence of a PC where you see a big screen and you're able to look in the eyes. I hate to tell you, but clinics have gotten to the point where I'm so busy typing into the computer that I forget the patient's right there. This synchronizes that. And now with some of the technology to do, natural language processing, that conversation gets immediately put into the EHR. So it's going to actually force that component, that streamlining of data. And then, as Archie said, that data, those data are what you're going to learn from as you go forward. We just have to get better at sharing data. And I think that's going to be something that we're going to see ease up a tad.
So there's a question from our audience. Say, with the pandemic, low-income families have not enjoyed ready access to data that more well-to-do families have. Will society be experiencing a data divide in addition to an economic divide? How do we address this going forward? Anyone?
A great question. The only thing that I would comment about that, and I got the experience of working at the end of a clinical program during this crisis. So I got to see the range of folks, but a screen doesn't matter. Whether it's on your cell phone, whether it's on your thumb, you can, if they don't have cell phones, there's going to be communities that have hookups. And you'd rather go to a community with a hookup than a hospital. So one of the things I get excited about is working with satellite companies, which we're doing, because they're giving you bandwidth. And the content that they want to do is exactly what Archie says, and that is education and healthcare. So I think convergence of some of these is actually going to decrease this economic gap that we're all sensitive to. I live in a privileged bubble. And when you go and work in the emergency room for a number of weeks, you learn to appreciate that. But I really do, like John says, technology is going to help, I hope, narrow that gap.
Yeah, I mean, this is not unusual even in the academic sphere, where you put 6,000 students out into the world to take your classes remotely, and we had to be very mindful that all of them had the right type of access to actually get the content that we wanted them to get and be part of the experience that we were putting online for them. So
Yeah, I think it's a great, I think it's a great question, and I think it's a hard question, but I would say maybe stepping away from the mechanics. I think this crisis, if I look back, I don't think that the world has pulled together at this level, right? In terms of just coming together to solution. And if you look at private, corporate, if you look at all types of investments that people are coming through to help really solution, especially I think in education and on the healthcare side, it's pretty phenomenal, right? So I don't know that we won't always have some level of divide, but I do see incredible investments being made, right, in communities, with schools that don't have the means, or students that don't have the means. And I just, like I said, maybe I'm being overly optimistic, but I've never seen, at least in my lifetime, I think people pulling together as much as I've seen through, the past, 3 months or so.
Absolutely. The volunteer numbers are staggering, at least in my world in healthcare. It's amazing. And I don't know how temporary that's going to be, but I think technology has a way to at least get people used to that and narrow that divide.
Yeah, the volunteer hours, plus I think also, even the resources, the investments that are being made, right? I know, for example, we're donating, devices, but we're also, making economic contributions on, helping, with the cure, et cetera, right? So I think every, major company out there is doing something. I think a lot of individuals, whether they're volunteering their time or making donations, I think there's a lot of great, pulling together, like I said, at a humanity level, to, address not only progress, but this question around, reach of and accessibility for more by everybody.
Yep.
Yeah, I mean, of course, anytime you make this kind of a shift, there are hazards that you must guard against. And somebody in the audience remarked that they are very concerned about the inappropriate prescribing based on virtual visits. So any sort of step that you take in this direction has to be carefully monitored and make sure that we don't create another disaster down the line. But let me ask you this question. In each of your individual positions and work environment, what is the single biggest challenge that you have faced with regard to consumer expectations during the pandemic? Start with you, John.
Well, I'll jump to one item. It hasn't been a challenge, but it's been a focus, and I'll say this and then broaden it out to consumers that exist outside the employee base and family base that we have. I think we've taken the position through this pandemic that our employee safety, our the safety of families of our employees, that is extremely important. And it's transitioned over the course of time to address what is the emotional balance that we ask for all of our employees and family members to recognize that additional strain. So I think there's this first aspect, which is how we deal with our employees, how we deal with consumers, is recognizing that there's an emotional contribution to how consumers are reacting. And while I think it's productive to be online on Zoom, there's certain things you can't see unless you see the person personally. You can't get that emotional aspect. So I'd have to say we've been challenged by being disconnected from not only our employees, but our consumers. How do you get that feeling? And I think a lot of it's been, as an organization, we've said, you got to get out. You've got to go out into the community and see what it's like in the grocery store, what it's like, out in the community, and really push a part of our organization to do that, to really feel what the consumer's feeling, to take that aspect into account. The same way, we try to spend an increasing amount of time understanding for our employees. It's how are they, we don't just say, how are you feeling? How are you doing? How are you doing? And I think that's an important aspect we can't lose sight of, because when we're remote and when we're distanced, not only from perhaps family members, but also employees, how we really get to the crux of how they're doing. And that's important for consumers, no matter what market you're in.
Yeah.
The stress level of physicians, as Peter can relate to, in hospitals that are overwhelmed, it's overwhelming. And as we're expecting, care for other patients with other procedures in the hospital, we need to understand that that's an overwhelming feeling as they try to deliver healthcare in a dynamic environment.
Archie, do you have anything to add to that?
Yeah, I mean, I would add to John's comment. Look, I think our first challenge is just keeping our employees safe, right? And it's not just about, it's physical, it's the emotional, it's, even mental health, right? People are cooped up, so there's an element of, the whole being, and how do you keep people, safe and, kind of in it, depending on how long this thing lasts, it gets more and more challenging. And so I think that's priority number one. Priority number two for us, I know I'm looking at some of the Q&A coming in. Look, we don't go direct to consumers, but our customers, again, span many different industries. And so the second is, the second priority, in my role is, no disruption, right? So overnight, almost 100,000 people are now working from home, right? So we have to be able to scale. We have to make sure that nothing disrupts our customers who do service consumers. And so that mindset of, no matter what we have to do, the heroics to keep things operational and going, that's the second piece of this is, in a crisis, you do it for, a short period of time, right? And you hope that you go to a new normal, you go back to normal. We're defining that new normal as we go along. And, the one thing we haven't talked about, which, I think in recent weeks, I think some of the things that are going on socially, has created, I think additional stress in all of our businesses. And, we're, as a company, we're attacking that head on and dealing with that on the human element side, right? So, we've got that. I imagine we'll have more political coming down the pike here. So, there's additional layering, right?
Can I turn and look on the other side of the curve? Because one of the things that has depressed me a little bit is we have flattened this curve, which was appropriate because, Archie had to help Medtronic make enough ventilators, and that's what we were trying to prohibit, is an overstretch of beds, ventilators, etc. But there's a downside to flattening that curve, and that means that it just lengthens that runway out a long time. And what I'm seeing is tremendous more mental health, tremendous more abuse domestically, drug, and other fixes, alcohol, tremendous amount of suicide, homicides. So there is a death that's happening that is a little bit more, and I don't mean to be morbid here, but it's a great opportunity for innovation. And most of the innovations that I see coming into our firm are targeting some of these more tangent but real downsides of this pandemic. And I think those are going to actually change the way we take care of patients. You're not going to line up and go see a psychologist. You might be able to do some of that more conveniently, more effectively with some of these technologies. And so that, I hope, is going to help with this vast new reservoir of mental health abuse and suicides. So,
thank you. All right. So as I want to end this on a bright note, and
don't ask me that.
So let me ask each one of you to just take a minute or so to tell us a little bit about how Rensselaer has influenced your professional progression. Let me start with you, Archie.
Yeah, maybe I'll just share just a minute here on the journey. So I did my MBA at Rensselaer, and it was while I was working for United Technologies. Great partnership between UTC and NRPI, and so I was a beneficiary of that partnership. And for me, it was earlier in my career, and I think just having a well-rounded, broad education view of the business, all the different functions, how it operates. It's really been that foundation, right, which has allowed me to continue in my journey and what I wanted to achieve, but also in the value that I can bring to each of the businesses that I've been in. So I look at that as a foundation building block that Rensselaer, helped me to achieve and the path that my career has taken.
Thank you. Peter?
Support. And a California kid learned how to wear a coat every day because it's not all that warm in the winter. But I found the engagement, and I did more on the satellite communication, digital communication group there. It was the 7th floor. And I found the engagement of the professors, the research programs, and just the overall academics as good as I've ever seen. And I've been to a few institutions, and I was not surprised because I was oriented there by some folks that I trusted, but I thought that they've continued to be provocative and timely. And I think that is evidenced by some of the research that's going on there, from AI all the way to cellular, as Archie said, 5G and all those type of things, and the interconnects. Listen, as we get into this, arena of communication, it's going to spawn a whole bunch of other things like security. It's going to spawn a whole bunch of other things that are going to be really important. And I always found RPI was kind of at the cutting edge of all those epics that were happening. And I expect the same thing today with this tsunami that we have going on.
Thank you, Peter. And of course, John, I mean, we've told you everything that we have to offer. 5 degrees from the university. You must have something to say.
I guess I bought a good coat and I wore it often, Peter. So, as someone who through 8 years in Troy and 5 degrees from RPI, I oftentimes say that it gave me a great foundation in problem solving. But I'd have to say through the course of my career, I've recognized it's more an ability to identify the problem to solve. I mean, I think there's always, as you move on in a career and you move from being an engineer to being an engineering management to being a business unit manager to leading a large corporation, the problem is not as well defined as you would like. And identifying which problems to direct your team to solve ends up being almost more important than solving the problem, because if you solve the wrong problems, you don't move the needle. And I think it's been the education that I got at RPI, where things aren't always unidimensional. It's not we would say in healthcare, it's not a medical problem, it's not an electrical problem, mechanical or structural, because your body is much more complex. And you've got to look at things from multiple perspectives. And that requires you to work in teams. It requires you to understand your blind spot or your bias, and to balance your perspectives because of that. And I think what I learned and came out of RPI was a great foundation to not only be a good problem solver, because you don't get promoted in your career unless you actually do solve a problem here and there, but to take a step back and truly identify what are the problems that can have the most impact when they're solved, and to commit yourself to do that and have the conviction to see it through, and then surround your people who are smarter than you are, and realize that they're eventually going to be the ones to solve the problem. You just need to put them in the right direction. I feel like Rensselaer gave me a great foundation to do that.
Thank you. Thank you for sharing that.
Great.
Well, I would like to thank each of you for joining us today and for adding your insight, sharing your expertise on this topic that has been on many of our minds as we watch the world as it begins to reopen from the COVID-19 pandemic. I don't know whether the timing is right or not. I suppose time will tell. But it's that time when I need to turn the podium back to our announcer, who will conclude with details for future virtual events. So thank you again.
Thank you.
Thank you, Dr. Izella and panelists, and for all of you in attendance. We hope you enjoyed the program. So going forward, you'll be receiving an email with today's recording along with a brief survey asking for feedback. Please be sure to check your email for information about upcoming webinars as well. We'd also like to ask you to save the date for 2R Pi Day on June 28th, a virtual event where we can support our institute and stay engaged with our community online. For more details, visit piday.rpi.edu/2rpi. And finally, as you heard from Dr. K Peck, now more than ever, support is needed to continue the exceptional tradition of Rensselaer education for our incoming and current students. There are many ways you can provide support, including the annual fund, the student relief fund, and the newly established research fund. A big thank you to all those who have generously supported these efforts recently. For more details, please visit giving.rpi.edu. Thank you again for joining us today. Stay safe and healthy and have a great afternoon.
Thank you, everyone.
Thank you. Thank you.